The dentist involved the dentist standing over me, chattering away, saying all manner of nonsense, while I had to just sit there, listening, unable to speak. Silently squirming in my seat, just hoping the entire painful ordeal would soon be over. Well, now the tables have turned. Now it's my turn to speak, and it's your turn to just sit there and squirm. For the next few minutes, I'm going to share with you a few personal stories of oral health. I hope that in each of these stories is a small lesson for the next generation of dentists. I hope these lessons, when taken together, weave a coherent narrative. So, class, here goes. As far as I remember, I never saw a dentist myself until I was 11. This strange man opened my mouth wide and dug around and scraped for a while, until he had the nerve to say that I needed a couple of fillings. Soon he was injecting and drilling and inflicting all manner of unpleasantness. I was not a fan of this guy, not a fan at all. As far as I had known, my teeth were just fine. What a jerk. It would be 11 years before I went back to a dentist. What's the lesson to be learned from this story? Well, there's really no nice way to say this, so I'll just say it. Dear dentists, people don't like you. Sorry, but except when a painful extraction is needed right now, nobody's happy to see the dentist, right? Think about the portrayal of dentists in the movies. There's Steve Martin, that's the sadist from the Little Shop of Horrors, who sings, "Be a dentist, you have a knack for causing great pain." Or the wicked dentist wearing a creepy baby mask in Brazil. Or Laurence Olivier torturing Dustin Hoffman in Marathon Man. Is it safe? Is it safe? But you don't go into this field because you want to be liked. If you wanted to take on a profession where everyone liked you, you'd be the pizza delivery person. Everyone loves the pizza guy, right? What are the 2 happiest words in the English language? Pizza's here. What are the 6 most miserable words? The dentist will see you now. So that's lesson number 1, people don't like you. The second time I remember going to a dentist was 11 years later, and I was 22. Once again, a dentist said I should have 2 small cavities filled, one on the left and one on the right. I had one filling done with painkiller and one without, so I could understand firsthand the difference. So here's lesson 2 for today. Painkillers are our friend. In preparing for this talk, I asked a lot of people, what would you say to a school of dental students? The most common answer was, by far, use lots and lots of painkillers. Novocaine, gas, whatever it takes. I guess people don't like pain. Go figure. During this second dental visit, from the new room next door, "I can fix that," the dentist said. No, said the woman, "just pull it." The dentist explained to her that it wasn't a big deal, it would be fast and cheap, and the tooth would be good as new for the rest of her life. The Indian woman thought that saving a tooth was a ridiculous notion when it could so easily be pulled. That dentist later told me that that wasn't an unusual point of view for some of his patients, and that in India you could find guys whose office was a piece of ground by the side of the road, where they were ready to pop out a tooth quick and cheap. You can watch this for yourself on YouTube, but don't. It's disgusting. Lesson number 3 is about trying to understand the traditional place of oral health within the hierarchy of human needs. If whole cultures could just as soon have a tooth pulled as repaired, which until fairly recently would have been the choice of all cultures, then how important do people perceive oral health to be? Nowhere on the pyramid representing Maslow's hierarchy of needs does there appear good teeth. There's food, water, and sleep, employment, family, and sex. In 2014, we would probably add access to a mobile phone near the base of the hierarchy. That's right, I wager that if you asked everyone in the world today, would you rather lose your mobile phone or your tooth, the majority of people would choose to keep the phone. I asked my neighbor, Harvey, a retired periodontist, about this topic. I wondered why dentistry is treated differently than other areas of healthcare. Why is it a different profession, treated differently by insurance, governments, and schools? Harvey said, if you lose your teeth, you can still go on to live a long life. If you lose your liver, not so much. I don't mean to trivialize the importance of oral health compared to general health. More and more we learn of connections between digestion and health, and of bacterial colonies of the mouth and their detrimental and predictive interactions concerning other vital organs, and of all the general tie-ins between our oral health and our general health. Here's an awful story. My My friend's mother died unexpectedly in her sleep one night from an untreated abscess tooth, leaving him behind as a young orphan. So yeah, oral health is important. But historically, at least, it has not been seen as important as, say, measles shots and fresh milk. So, if oral health is as relatively trivial as I've tried to make it seem, why go into the field at all? Is it for the money? From 2004 to 2012, I lived in an affluent part of California's Silicon Valley. It's so wealthy I just had to sit silently while he worked. For some reason, he also really loved to talk about Dog the Bounty Hunter. Although I didn't share his views about politics or reality TV, I always returned because he was an excellent dentist. For example, for my 45th birthday, I rewarded myself by having 2 troubling wisdom teeth removed. They had been a constant but mild source of irritation for at least 20 years. This guy pulled out the first wisdom tooth before I even knew he had started. 1 second, I'm sitting there in the chair, waiting for the Novocaine to take effect, and the next second, he's holding something in front of my face. What's that? I asked. It's your tooth. I couldn't believe it. 20 years of irritation gone in a painless instant. Being in the middle of Silicon Valley money, that dentist did not have to work a lot. His weekly schedule was 3 days in the office and 4 days on the golf course. That's when he wasn't in his second home in Hawaii, probably hoping to sight his hero, Dog the Bounty Hunter. So lesson number 4 is you can make good money in dentistry and related specialties if that's the most important thing to you. It's hard to deny that there's some appeal in that approach. Speaking of money, we have to ask, why would Brent Noorda, my mother, feel that oral health was so important that she would donate a giant walking pile of money to build a school? Why not put that money in, I don't know, fighting malaria and providing clean water for the world's poorest? Let me tell you a few things about Mom. First, she did donate oodles for malaria, water, food projects, and the like. Second, Mom could never forget the most dramatic event of her life, recalling it even a half a century later as if it had happened yesterday. That was the time, not many years after she was married, that Mom was walking down a staircase. Being an actress and model, she had been trained to walk down the staircase with elegance. Elegance meant not looking down as you descended. That one elegant time too many, she fell. She fell hard. She lost a lot of teeth. She lost her smile, at least for a while, until she had completed a set of false teeth and dentures. Mom never forgot the effects of losing her teeth or losing her smile. She didn't forget the effects on her self-confidence and self-esteem. By the way, that trauma did not end there. As children, nothing would freak us out more than when Mom would remove her teeth, which she would do occasionally with great effect, pulling them out slowly, turning and smiling. Yeesh! She loved to play that same trick on her unsuspecting grandchildren. So that one fall traumatized 3 generations. The third thing to know about Mom is she loved to write and sing songs. Her #1 big hit, by far, was called Smiling. Smile, and you'll start feeling happy. So lesson number 5 is, don't frown on the importance of a good smile. Our mouths, our teeth, and our smile are so important to our sense of self-worth and esteem, which bring us back to the pyramid of human needs. Self-esteem, confidence, and respect can be so enhanced or degraded by the state of our teeth and gums. Consider a rehabilitated drug user. You can kick the meth habit, but as long as you're walking around with meth mouth, you have not kicked the stigma. That is what my periodontal neighbor refers to as the psychosocial reasons that people need oral health. Harvey, my neighbor, would ask every patient a question, and he suggests you all do the same with your patients. He would ask, what is important to you? Once you know what is important to them, and he says it's almost always related to their psychosocial well-being, you'll know how to treat your patient. I feel I need to talk about my son now, Albie. I didn't meet Albie until he was almost 6, as I became his foster and then adoptive father. Albie is 28 now, and he has gallantly agreed to let me share his story. Before Albie came into my life, he'd been neglected and abused for many years, to the point that the parents who should have cared for him most were in prison for years for what they'd done. He'd been severely malnourished, with the tiny stature and distended belly you would normally see on a late-night commercial for Aid to Africa. It would take a few years to get his eating in order and growth on track, but by then he was already losing his baby teeth. Until very recently, I was completely ignorant about the amazing and lengthy process by which teeth develop. There's much more to it than just the tooth fairy. Did you know that our permanent teeth are already beginning to develop in the 20th week of pregnancy? And they continue to grow during infancy until they're ready to push out the baby teeth. I know what you're thinking. What? Adult teeth are growing for years before we see them? But where are they growing? I'll tell you, but it's totally creepy. So anyone who adores and loves any small children should cover their ears and go la 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 la. Okay, here it is. The teeth are growing right there in your kids' skulls, above and over and around the baby teeth. In their skulls. I've seen images and x-rays. It's truly frightening, like an H.R. Geiger poster for a new Aliens movie. Do not, I repeat, do not search for these images on the internet. But here's the thing. All that hidden, frightening development is happening long before the permanent teeth make an appearance. If the appropriate nutrients aren't available at the right times during fetal and infant development, the various parts of those teeth just won't develop right. In Albie's case, the result of early malnutrition is that as an adult, his teeth, especially his molars, were small and incomplete and were quickly rendered useless. This is not something we did a whole lot about until recently, other than to extract some useless and infected teeth, because there are other areas of health that had priority. As I've already said, oral health is not always the first priority. But recently, with the help of the UU School of Oral Health, especially Dr. Lavender and some of his students and assistants who have already been involved, Albie has begun the long course getting himself a full set of choppers. It is my hope that by this time next year, Albie is able to know the experience of chewing, really chewing, a full and delicious meal. So the next two lessons are from Albie's story. Lesson number 6, parents, feed your children and feed them nutritiously, because what they receive in utero and in infancy will affect their entire lives. By the way, the stuff you see in a restaurant kids' meal isn't food. Feed your kids real food, the same stuff you eat, okay? Lesson 7, students, I hope Albie's case can help you learn more about the dental situations you may come across and the root causes for them, and have sympathy for the people with those conditions. This next story doesn't involve oral health at all. Instead, it's about my ophthalmologist, my eye doctor. I have something called pterygium, which is a condition where a little jelly thing grows across your eyeball. It is thought to be caused by too much exposure to the sun. A few years ago, my little jelly thing had grown so much in one eye that I was losing vision and needed an operation. If you must know, and I think you do, it's an unpleasant operation. It involves sitting in the operating chair conscious as the surgeon sticks needles in your eye and then uses scalpels and such to perform small skin grafts from one part of your eyeball to another. During the operation, you're seeing these things very, very closely, and you have to be conscious because there are a lot of instructions to follow, such as look left, look right, up, down, stop screaming. Seriously, stop screaming. I mean it, dude, stop screaming. This goes on for about 90 minutes. So I guess you can add pterygium operation to the list of things you do not want to be looking up on YouTube. But I digress. The reason I'm talking about my ophthalmologist is because I've learned that he does a lot of pterygium operations, like mine, but usually not in a nice hospital setting. You see, I could afford insurance, but most of the people getting pterygium are migrant farm workers who don't have health insurance and have very little money to pay for a hospital operation. They still need to see, or else how can they pick for us our beautiful fruits and vegetables? And so, my ophthalmologist spends a lot of his Saturdays away from the hospital performing these surgeries for farm workers on his own dime. So 2 lessons from my ophthalmologist. Lesson number 8, wear sunglasses. Lesson number 9, it is your choice how you use your skills and what you choose to do with your days off. You are not required to play golf 4 days a week like my Silicon Valley dentist. That's the end of my personal stories. I hope you were able to learn something from these 9 lessons. I have no more to teach you. So let me talk about something you probably already know. You probably already know that a very sizable percent of our population is underserved or completely lacking in access to oral health care. We're not talking about developing nations, we're talking about right here in Utah. You know the reasons why so many lack sufficient care. For example, affordability, when you're having trouble paying the bills, feeding the kids, putting a roof over your head, seeing the dentist is not likely your first priority. lack of access. In many areas, especially far from a dense population center, the dental services are spread very thin. Most versions of health insurance don't include dentistry, and a lot of dentists don't accept Medicaid even if it's applicable. When dentistry is provided to the most needy, the elderly, homeless, mentally ill, preventative care, that's a hard word, preventative care has been missing too long, and it is too often just the literal pulling of teeth. I'm proud to say that the UU Dental School is committed to providing critical oral health care for the underserved populations. So while you are a student here, you will be dedicating your time and skills to those who need it most through clinic hours at the school. Imagine if there were also a mobile healthcare unit, how many more of the most needy, for whom it is unreasonable to get into the clinic, could be helped at their doorsteps. At the beginning of this talk, I promised a coherent narrative, so here it is. These 9 lessons tell us that currently, dentistry is unloved, painful, and in many ways still a relative novelty and luxury. That is the current state of the world you will be graduating into. But not too long ago, things like clean water, immunizations, and K-12 education were luxuries. Those luxuries are now basic rights as viewed by our general society, as together we have advanced up the hierarchy of needs. Because good oral health, a good smile, is so important to our esteem, I predict that the day will come that basic oral health also moves from being a luxury to being a basic right. Until that day comes, there will sadly remain a lot of people, young, old, poor, ill, remote, or just plain unlucky, without access to dental care. A whole lot more people than can ever be served at the UU Dental School. Students at the UU Dental School, you will serve the underserved. That's just what we do here. Your big challenge comes in a few years after you have graduated. You will have to decide if you're going to continue to help those who need your help the most, but are at least able to afford it. So in your professional life, in your professional game of life, you will each have to answer this final Jeopardy question. Are you my Silicon Valley dentist, 3 days working and 4 days at the golf course? Or are you my eye doctor, giving us Saturdays so the field workers can see? Wait. I have one more lesson about teeth. Something they don't teach you in dental school. Your teeth are a musical instrument. Yay. Popcorn, anyone? Thank you, students, faculty, and music lovers.